Here we have a sagittal view of the inside of the face, some facial structures with the oral cavity, the nasal cavity, and the beginning of the pharynx or throat. Here would be our oral opening into the mouth, the oral cavity here. The top of the mouth, we can see there is still bone here, making the hard palate. Towards the back, we have the soft palate, which is much softer tissue. The bottom of that making up the uvula, which is that little hingy ball thing in the back of your throat. Up here we can see the nasal cavity with all those nasal conchae benches and the meatuses, little tunnels that air flows through in between those conchae benches. We can also see some of the sinuses, the open spaces in the skull bones. In the back of the nasal cavity, this would be the nasopharynx, and in that nasopharynx, this loby, bumpy material up here, this is what we refer to as the adenoids or the pharyngeal tonsils. In the back of the oral cavity, you see that same loby, bumpy material here, making up the palatine tonsils or palatine tonsils. Those are the ones that are most commonly removed when people have their tonsils removed. If you don't have your tonsils removed, you can actually see these in the back of someone's throat. This open space here, this would be the oropharynx. And then you have the laryngopharynx leading into the voice box. Here we would have the trachea with the esophagus behind it. This makes up what's called the epiglottis, which will fold over the trachea when you swallow so that food goes down behind the trachea into the esophagus and not down the trachea into your lungs.